everyone, my name is Catalina Bello and today I'm going to talk about secure attachment in infants. Have you ever had the opportunity to see a child crying in public place while his or her mother ignores him or her? Have you wondered what impact this has on their future mental health? During my years as a psychology student, I have always been interested in knowing how children's minds work. So I have focused on child development. This time I wanted to focus on the impact of early bonding between children and their parents. To begin with, I imagine that many of you are wondering what is secure attachment. But first, we should know what is attachment. According to Bowley, 1997, attachment is a term that describes the psychological connection that exists between human beings. There are different types of attachment which we'll talk about later. Understanding what is attachment, you may be wondering what is secure attachment. According to an SPC 2021, secure attachment is the relationship between caregiver and child that is perceived as loving care, attentive to needs, and constant. There are different characteristics that indicate the type of attachment. According to Ainsworth 2015, the characteristics are present in children with secure attachment are proximity maintenance, the child wants to be near their primary caregiver, safe haven, returning to their primary caregiver to comfort and safety if they feel afraid or threatened. Secure base, treating that their primary caregiver as a base of security from which they can explore the surrounding environment. The child feels safe, that the knowledge that they can return to their secure base when they need it. Separation distress, experiencing anxiety in the absence of their primary caregiver. They are upset when their caregiver leaves, but happy to see them to easily comfort. Now that I have explained what it is and the characteristics, I will tell you about other types of attachment. In addition to secure attachment, there are three other types of attachment that are not healthy for children, much less for their adulthood. Anxiety attachment is marked by clinginess and anxiety about abandonment. This style often develops from inconsistent caregiving, where a child's needs are sometimes met and sometimes neglected. In adulthood, a parent with this style may be seen as clingy, needy, or not trusting, can be consumed with the concern that their loved ones will abandon them, and they may seek constant reassurance that they are safe in their relationship. Avoidant attachment involves emotional distance and reluctance to depend on others. This style often results from caregivers who are emotionally unavailable or dismissive of the child's needs. Adults can be seen as self-reliant and emotional guardians. They are unlikely to see emotional comfort or understand how to comfort their partner. Disorganized attachment, often resulting from trauma or inconsistent caregiving. Children with this attachment style may experience caregiver as both a source of comfort and fear. Adults are likely to live with mental health disorders or personality disorders that prevent them from developing healthy relationships with others. They are likely to crave close relationships but push others away when they show the attention. Attachment between a caregiver and child develops during the child's growth. The stages of attachment being when the baby is in the womb. According to Prior and Grazer in 2006, the first 2 years of child life are the most critical forming attachments. Antenatal, before birth, pre-attachment, birth until 6 weeks, attachment in the making, 6 weeks until 6 to 8 months, clear-cut attachment, 6 to 8 months until 18 months to 2 years, and formation of reciprocal relationships, 18 months to 2 years and onwards. Finally, I would like to explain secure attachment is so important. It is important because attachment styles influence expectations and behaviors in adult relationships. According to Dr. Daring, babies who grow up in secure attachment are more likely to become adults with healthy relationships and are reliable partners. The benefits and effects are helps children regulate their emotion, which has a positive impact in their neurological, physiological, and psychosocial development. They are more likely to develop emotional intelligence and strong mental health. People with a secure attachment style are better able to establish lasting and healthy relationship with others. They are more likely to trust and be emotionally available to their partner. In a study that sought to investigate whether early contact between mothers and preteen infants influenced the development of secure attachment, 62 infants were assessed using a procedure known as strange situation to Klaus and Klenel 2006. The study demonstrated how premature infants having contact in the first hour of life favors secure attachment. In 53 of the babies, they develop a secure attachment. As I explained before, there are negative effects with other types of long-term affect. Not receiving comfort and security in the early years can have negative effect on children's neurological, psychological, emotional, and physical development and functioning. Newman 2015. During a study which examined the relationship between parental alcoholism and behavioral problems in their children between 18 and 36 months of age, according to the study of 18 to 2023, it was shown that families with problems such as alcoholism in parents, those children who have secure attachment, show fewer behavioral problems. For this and many other reasons, the secure attachment acts as a protective factor in children. I know it is a lot of information, but I hope this topic will be as fascinating to you as it is to me, as well interesting. Thank you.